Let me ask you to state your name, please.
Dr. David Portman.
And you are?
I'm the director of the Columbus Center for Women's Health Research and in private practice of gynecology in Columbus, Ohio.
And we're here at the North American Menopause Society, and I have been reading an abstract by Dr. Portman that I'd like to share with you. And tell us, what is this abstract about? What is the study you did?
Well, one of the things that was looked at was whether or not medication, in this case osphemifene or Osphena, could improve symptoms other than simply the most bothersome symptom of vulvovaginal atrophy or symptoms due to menopause affecting the urogenital tract.
So this is about, you were looking at painful sex due to menopause and shrinkage of the vaginal tissues and seeing how much this improved the person's experience.
Right. So the FDA wants us to look at a patient's most bothersome symptom. That seems to be what they feel is the important thing to look at. Mm-hmm. But we as clinicians know that other symptoms affect patients as well. So while the patients in these studies came in and had either a most bothersome symptom of dryness or pain with sex, they also reported other moderate to severe symptoms. The purpose of this sub-analysis was to see whether or not those symptoms improved as well, and indeed they all appeared to improve in addition to the patient's most bothersome symptom improving.
So specifically, what was the main finding that you observed in this particular report?
Well, we observed that perhaps the most bothersome symptom, which is now the definition that the FDA would like most of the treatments for this condition to abide by, may not be the most sensitive way of gauging whether or not a treatment is working. Because we were able to demonstrate that patients have more than one bothersome symptom and that treatments may in fact improve a myriad of those symptoms.
So, as I understand it then, you did an analysis of the symptoms that patients reported, and although the FDA only accepts one reason to give the medication, you find that the Osphena medication was actually able to improve a number of symptoms related to painful sex.
It does improve a number of symptoms, some statistically, some numerically, but because the guidance really limits you in studying one particular most bothersome symptom, we felt that this information would be very useful to clinicians because we know that we don't treat just one symptom when a patient comes in, we treat the entire patient.
Of course, so this is good news for women who are looking for non-hormonal approaches to treat painful sex.
Correct.
Thank you very much.